Welcome to Healthism. Today's video where we're going to talk about the warning signs of cancer that may appear a month before the actual symptoms show up. I'm sure you've heard of cancer before, right? But have you ever wondered if your body can give you any hints before you actually develop the disease? Well, in this video, I'll tell you about some signs that you should pay attention to. If you notice any of these signs, it's important to seek medical attention right away because they could indicate that cancer is about to develop. These warning signs can start showing up as early as a month before an official cancer diagnosis. Alright, let's dive in. One of the first warning signs is persistent and unexplained weight loss. Sometimes weight loss can go unnoticed, especially if it happens gradually. However, it's important to understand the significance of unexplained weight loss and take action promptly, as it can have a big impact on your health journey, especially when it comes to fighting diseases like cancer. So, when your body starts shedding pounds, it's actually a signal that something might not be right. You see, cancer cells can be pretty demanding. They hog up a lot of your body's energy supply and even release substances that mess with how your body turns food into energy. And that, my friend, can lead to weight loss. But here's the thing, sudden weight loss is no joke. It could be a red flag that cancer is lurking, even before any other symptoms show up. Catching cancer early is a big deal. It makes treatment way more effective and can seriously up your chances of survival if you've already been diagnosed. If you notice that numbers on the scale are dropping, it might mean that the cancer is progressing. That's a sign for the doctors to take another look at their treatment strategies. Having this kind of info is gold for them. It helps them customize a treatment plan that actually works and is doable for you. Moreover, being in better physical shape can make a huge difference in how well someone responds to cancer treatment. Treatments like chemotherapy, radiation, or surgery can be really tough on the body. But patients who maintain a healthier weight often experience fewer side effects and complications. Plus, they're in a better position to bounce back faster after treatment. On top of its impact on cancer treatment and recovery, addressing unexplained weight loss can also improve overall quality of life. Losing weight can lead to fatigue, weakness, and a decreased ability to do everyday activities, which can really affect your overall well-being. By seeking medical advice early on, you can identify the underlying cause of the weight loss, whether it's cancer or another health issue, and take the appropriate action. So, taking care of your physical health not only helps with cancer treatment, but also improves your quality of life. Hey there! Sometimes, when you or someone else starts losing weight without even trying, it could be a sign that something's up. It's important to see a doctor in those cases. They can run some tests to figure out what's causing the weight loss. These tests might include blood tests, imaging scans, or other diagnostics to check for signs of cancer or other health conditions. The sooner they find out the cause, the quicker and more effectively they can address it. Now, let's talk about excessive fatigue. Feeling extremely tired all the time, more than what's normal for you, could be a hint that something's not right in your body. Sure, it's normal to feel tired after a long day or a bad night's sleep. But excessive fatigue is different. It doesn't go away with rest or sleep, and it might be a clue that your body is dealing with something serious, like cancer. It's super important to listen to your body and pay attention when something feels off. If you're way more tired than usual for no clear reason, it's worth checking out. Cancer can cause this deep level of tiredness because it takes a lot of energy from your body. Sometimes, cancer cells mess with your body's energy production, leaving you feeling drained. Plus, your body might be working overtime to fight off the cancer, making you even more tired. But hey, remember, feeling super tired can also be caused by lots of other things, not just cancer. Stress, other illnesses, and different health conditions can also make you feel exhausted. That's why it's crucial to have a chat with a doctor if you're feeling this way. They can help figure out why you're so tired by asking questions, doing tests, and checking your overall health. And if it turns out that it's because of cancer or another health issue, they'll guide you through the next steps. Hey, if you're looking to feel better, there are a bunch of ways to get started. One option is to explore treatments for cancer or get advice on how to manage your energy levels more effectively. It's worth noting that catching any illness early, including cancer, can make a big difference in how well treatments work. So, If you're feeling exhausted all the time and it's not your usual self, it's important not to ignore it. Seeing a doctor can help you figure out what's going on and get you the right help to start feeling more like yourself again. Now, let's talk about some changes in your skin that you should pay attention to. If you notice new moles popping up, changes in the ones you already have, or getting rashes without a clear reason, it's time to take notice. Oh, and if you happen to see your skin and eyes turn a bit yellow, which doctors call jaundice, that's definitely a red flag. Your skin can be like a huge billboard that displays signs of what's happening inside your body, including warning signals that something might be off with your health. For instance, new or changing moles can sometimes be a sign of skin cancer, which is why keeping an eye on them is super important. If a mole gets bigger, changes color, or starts to look odd in any way, it's time to have it checked out. And remember, it's not just about moles. Other skin changes can be clues too. A rash without an obvious cause or yellowing of your skin and eyes might indicate issues with your liver or other parts of your body. Taking care of your health involves paying attention to what your body is telling you. So, keep an eye out for any changes and don't hesitate to seek medical advice if something seems off. Hey, remember that changes in your skin can happen for various reasons, not just because of cancer. Allergies, infections, or other skin conditions can also cause these signs. The important thing is not to ignore them. It's a good idea to have a doctor take a closer look, maybe run some tests, and figure out exactly what's going on. They can tell you if it's something simple that can be treated with a cream or if it's something more serious that needs more attention. Getting to a doctor early when you notice these changes can make a big difference. Early detection is key when it comes to dealing with many health issues, including cancer. So, if your skin starts acting differently, showing new signs, or just doesn't feel right, don't wait. Make an appointment to see a doctor. Taking action early can help keep you healthy and give you peace of mind. Plus, taking care of your skin is part of taking care of your whole self, so it's always worth paying attention to what it's telling you. Now, let's talk about a persistent cough or hoarseness. Having a cough that just won't quit or a voice that stays hoarse for weeks isn't just annoying. It could be a sign that something serious is going on in your body. While it's true that coughs and scratchy throats can often come from less serious things like colds or allergies, if these symptoms stick around for a long time without getting better, they deserve a closer look. Persistent coughing or ongoing hoarseness can sometimes be early warning signs of lung cancer or throat cancer. So, it's important not to brush them off. If you're dealing with these symptoms, it's a good idea to seek medical attention and get checked out. Remember, your health is important, and taking care of yourself includes paying attention to these signals. It's kind of scary to think about, but catching these types of cancers early can really make a difference in how well treatments work. That's why it's so important to pay attention when you have what seems like a stubborn cough or a hoarse voice. But hey, don't jump to conclusions. Just because you have a cough doesn't mean it's cancer. Coughs can be caused by lots of stuff, like acid reflux, smoking, or even dry air. But here's the thing, if these symptoms stick around for a long time with no clear reason, it's time to see a doctor. They can ask questions, do some checks, and maybe run tests to figure out what's causing it. Finding the reason behind a persistent cough or hoarseness can help catch serious conditions like cancer early on when they're easier to treat. So don't just brush off a cough that won't go away or a voice that's been all raspy for too long. Getting it checked out isn't just about feeling better, it's about listening to your body and taking care of your health. Remember, you're the best advocate for your own health. Now, let's talk about changes in your bathroom habits. If things start to get wonky, like suddenly dealing with ongoing diarrhea or constipation, or if the color of your pee or poop looks different, it's more than just a minor inconvenience. Your body might be trying to tell you something important. These changes can sometimes be a sign of something more serious going on, like colon cancer, bladder cancer, or prostate cancer. Now, it's normal for everyone's bathroom habits to vary a bit from day to day based on what you eat or how much you drink. But if you notice consistent changes that don't go back to your usual, it's worth paying attention to. For example, colon cancer might make your poop look narrower than usual or cause blood in your stool, while bladder or prostate cancer might change the appearance of your pee or make going to the bathroom more difficult. I know it's scary to think about, but not every change means you have cancer. There are plenty of less serious things that can mess with your bathroom routines, like infections, certain fruits, or even just stress. That's why it's super important to talk to a doctor if these changes don't go away. They can help figure out what's causing the symptoms and if it's something that needs more attention. Doctors might ask you a bunch of questions about what you've noticed and do some tests to get to the bottom of it. Catching any kind of cancer early can really improve the effectiveness of treatments, so getting checked out as soon as you notice something's off is really important. Plus, even if it turns out to be something less serious, getting help can make you feel more comfortable and put your mind at ease. Hey, if you notice any changes in how you're going to the bathroom or using your bladder, it's important not to brush them off. It's a good idea to see a doctor and have a chat about what's going on. Taking care of your health starts with listening to your body, and you know it best. So, if something feels off, it's always better to get it checked out. Now, let's talk about difficulty swallowing. It's when eating doesn't feel as smooth as it should. You might feel like food is stuck in your throat or chest, or you could even cough or choke while trying to eat. It may not seem like a big deal at first, but difficulty swallowing can actually be a sign of something more serious, like throat or esophageal cancer, or even issues with your stomach. So, if you're having a hard time swallowing and it's not getting better, pay attention to what your body is trying to tell you. Don't ignore it. It's worth getting it checked out. Cancer can make it tough to swallow because it can mess with the tissues or make it harder for the swallowing muscles to do their job. But don't jump to conclusions. Having trouble swallowing doesn't automatically mean you have cancer. There are other less serious things that can make swallowing a challenge, like infections, acid reflux, when stomach acid creeps up into your throat, or even tension in the throat muscles. That's why it's important to see a doctor if you're having a hard time swallowing. They'll ask you some questions, check your overall health, and run some tests to figure out what's causing the problem. Getting help for difficulty swallowing is crucial, not only to determine if it's cancer or something else, but also because it can impact your health in other ways. If swallowing becomes difficult, you might not eat as much as you should, which can lead to weight loss and a lack of essential nutrients. Plus, constantly coughing or choking while eating can be risky and stressful. So, if you've noticed that swallowing feels tougher than it used to, don't wait around hoping it'll magically go away. Talking to a doctor can help you get to the bottom of it, whether it's a simple issue or something that requires further treatment. Remember, catching any health problem early, including cancer, gives you the best shot at dealing with it successfully. Plus, getting the right help can make eating easier and less stressful. Hey there! When it comes to enjoying your food and staying healthy, the last thing you want is to be bothered by unexplained pain or discomfort. If you're experiencing persistent pain that just won't go away and you can't figure out why, it's definitely something you should take seriously. This kind of pain, especially when there's no obvious cause, could be your body's way of telling you that something isn't right. Now, I'm not saying every ache or pain means you've got cancer. Our bodies can hurt for all sorts of reasons, from simple muscle strains to more complicated conditions like infections or other diseases. But if the pain lingers or doesn't have a clear reason, it's not something you should ignore. The location of the pain can sometimes give doctors clues about what might be going on. For example, if you're feeling pain in your abdomen, it could be related to your stomach or colon, while discomfort in your chest might be connected to your lungs. Knowing where the pain is helps doctors figure out which tests they might need to do in order to find the cause. If you're dealing with this kind of unexplained, persistent pain, it's a really good idea to see a doctor. They can have a chat with you about what you're feeling, do a physical exam, and maybe order some tests like scans or blood work to gather more information. Catching cancer early, if that's what's causing the pain, can make a big difference in how well treatment works. But even if it's not cancer, finding out the reason for your pain is important. Living with constant pain can really make life tough, affecting your mood, sleep, and ability to do everyday activities. Getting the right diagnosis means you can start treatment to help relieve the pain and improve your quality of life. So, if you've got pain that's bothering you and there doesn't seem to be an explanation, don't just try to tough it out. Getting it checked out can help you find out what's wrong and what you can do about it. Remember, you're the expert on your own body. When something feels off, paying attention and reaching out for help is the best way to take care of yourself. If you found this information interesting and informative, please like and share the video. If you're new to the channel, don't forget to subscribe and share your thoughts in the comments below. Thanks so much for watching. See you in the next video.